Men are allowed to play rough, or should we say they are expected to play rough? Does that include that they are not allowed to express their softer emotions? Yes. All their lives, men are told to be mature, to be strong, and to man up. Mental health among men often goes untreated because they live their lives abiding by all these unwritten rules of society and in that process have not learned to seek help. Alarming statistics point out that depression and suicide are a leading cause of death among men. Men die by suicide at a rate 4 times higher than women. They also die due to alcohol related causes. Men are also 2 to 3 times more likely to misuse drugs than women. Hi, this is Millie Verma, an intern at the Mental Health Studio by Dr. Shiva Singh, and I'm here to discuss men's mental health in yet another episode of Expert Speak at TalkSpace. Our today's expert, Dr. Tanay Maiti, is a senior clinical fellow, Black Country Healthcare NHS Foundation Trust, Penn Hospital, Wolverhampton, United Kingdom. Welcome to the show, sir. We are delighted to have you. So I would like to begin by asking the question that, sir, can you tell us some of the common disorders that are prevalent in men?
So, men's mental health, though, has gained a lot of focus these days, but still, as a clinician, as what I have seen in my experience, is still under recognized, undervalued, and though the prevalence of illnesses, both the serious mental illnesses, what comes as schizophrenia, bipolar illness, or severe depression, or common mental disorders or common mental illnesses like anxiety, panic attacks, both are in quite high prevalences. And the problem is the hiddenness of the nature of the problem, which definitely we will discuss. That makes it more prevalent and more, I will say, worrisome when it comes to an attention. So all the illnesses are quite common. All the mental health illnesses, you call it psychosis, you call it depression, OCD, everything is quite common with some genetic variation and some gender variation. And also not to forget about the substance abuse or de-addiction problem. That's quite high in men specifically, which is still under-recognized and under-treated, which probably we need to take care of in future.
Yes, sir, absolutely. So, sir, you mentioned that there are a lot of disorders that are common, like substance abuse, depression. So, what are some of the signs and symptoms through which we can identify these? Some basic signs.
Okay. So, of course, the illness comes in the same way, irrespective of it's in a male or in a female. However, the what we say the internal symptoms and external symptoms can be different, and the presentation can be different based on the gender. Male specifically and particularly comes with aggression and disruption, with violence and domestic difficulties and difficulties in workplace, which is more noticeable and more common presentation and often recognized as behavioral problem or the personality problem of the particular person or male. You call it the social attribution or the gender attribution. But apart from all the classic symptoms, as you know, the psychotic symptoms, the paranoia, the low mood, whatever we see regular basis, being a mental health professional, be it a psychiatrist or psychologist. But apart from that, this externalization behavior and this violence is a very common presentation and often mistaken as a uh, outcome of personality factor, which we need to take care of and could be a serious attribution of the mental health outcome that is important. I'll give you a small example that's probably very relevant at the moment. Without taking the name, the very famous and one of the most famous cricketer of the country or the world. So there might come as if there is a recent revelation of about his mental health, and I am speculating that might come as a different explanation in future, but still the dysfunction, the inability to work, or what we say the disability, was very prominent, as the person has mentioned, which could be a very prominent signs and symptom both for a men's mental health issue.
Okay, sir. Sir, in your view, so what are some of the factors that increase the risk of mental health conditions in men?
That's very important. So I'll divide it into two segments. First, the known, what research has repeatedly shown us: middle-aged man without job or work, man with declining functioning, less social support, men with uh, addiction problem, men with alcohol. So these research has shown persistently over the last 30 years that these are the very recognized factors. Uh, Even white male are more prone to mental health problems rather than non-white males. Apart from that, the people who doesn't have access, or I will say more than access, the liberty to speak, as this is a common nature of probably any male, or the way society looks over the male, and also that reflects on self evaluation or a self image, if I want to be more particular, of any male. There, the self image and the inability, or I will say the unwillingness of reaching the service, reaching or recognizing, before reaching, the recognizing the problem is a very uh, often identified and very important risk factor specifically for male. Apart from the factors what science and the research has shown multiple times in the past decades. So the recognizing of the problem by the self, others, and after, even if they are recognizing the inherent nature of inability or unwillingness to reach the service, probably one of the very biggest risk factor we need to look forward in future.
Yes, sir. So, as you mentioned, that the unwillingness and inability to recognize the problem by the self and the others, this brings us to a very important and a very serious concern, which is that statistics have shown that globally the suicide rate for men is twice as high as for women, and in many countries, in fact, this ratio is even higher. So, sir, why it is that the men avoid seeking help with their mental health issues?
That's probably the most important question worldwide. Every clinician, every researcher is constantly trying to find out. Uh, so, what research shows, definitely, what about the social construct, that is very important. The gender role and how we see ourselves, and the consequences what we uh, often perceive being a human being, be it a male or female. That makes a lot of difference how anyone can is going to seek help for his health condition, and that turns immensely important when it is for mental health, for all the uh, personal, social, confidentiality issues. So suicide definitely comes quite uh, explainable from that aspect, as that attempted suicide or attempted self-harm is nearly 20 times higher in female than male. However, the completed suicide, researchers have shown up to 5 times more than double. Up to some studies has shown up to 5 times more common in male, and it's mostly the single attempt. So that needs a lot of discussion if we want to go into the deep. But if I try to summarize in one line or as a take home message, so men's, unfortunately, I will definitely say, unfortunately, self perceiveness of the consequences, what will have if I go to this, what will go. forget about professionals. What will have if I talk about this? How my friends, family, and others, society will perceive me, how they will consider me. So that already built up or social construct makes a delay, a huge delay. And of course, we need to remember the illness never selects a man or a female differently. So the presentation, the outcome, unfortunately, is very scientific and very what we say the natural course of illness is going to end somewhere for any illness, be it a cancer, be it a COVID infection, be it a mental health problems. So we need to understand that we all are human beings where male, female, both are prone for any condition by their own way, and the gap in between where though definitely every illness has their male or female uh, propensity, I will say, but irrespective of the illnesses, as you mentioned, that suicide of men is a huge concern since I will say last 50 years. It persistently has remained high. Still, we know some causes yet to come out, but probably the most important missing link is the help seeking and the self image and self recognition. Men can have mental illness too. Men do have mental illnesses too, even if it might sound uh, the correct word could be probably it's a biased sentence or putting more importance as on men's mental health as we are talking on men's mental health today here, but definitely not to forget about females issues as well. But men's mental health categorically is under recognized, and that is one of the, if not the sole condition, but one of the most important condition, the under recognition, which leads to the deadly or fatal outcome.
Yes, you very beautifully highlighted that illness doesn't select any person. Like it can happen to
Yeah.
anyone, irrespective of whether it is a man or a woman. So, sir, how can we create a safe environment so that men also come forward and they can talk about their problems? Basically, what can we do to break the stigma that surrounds men's mental health and dismantle the concept of toxic masculinity?
Yeah. Uh, the whole world is trying to find this answer. So are we as an individual, as a team, everywhere. Uh, so a uh, lot or a road ahead is quite long to reach the uh, outcome where we can reach some positive uh, effect of all the discussions and all the efforts. But still, if the in nutshell, if we can see, okay, I'm starting from new. I lost words. Okay, just edit it. So toxic masculinity is a social term, I will say, and of course, genetically, hormonally, and what we say phenotypically, the presentation, the how male behaves and female behaves are different by the nature's law. But as the society fixed role and how we see ourselves from the how we made to see ourselves, even if and this sounds a little odd to me, even we myself when I say that when we are finishing 2022, but still unknowingly, and even if we recognize it or we try to deny it, how a child or when adolescent they have been shown by themselves by the family and later how they perceive themselves uh, as an adult is still very different. There is no way we can deny that, and there are so many awareness. Of course the world is much different which it was 20 years back, but still there is a huge path to cross where everybody will consider their health issues irrespective of their gender. So what I'm trying to say that, of course, a male person's or a man's thinking pattern and a woman's thinking pattern will be different. They won't be in a same way or a same situation or same problem. However, when it comes for health, how we consider our health situation as important, when to take help, that needs quite a paradigm shift. And toxic masculinity is definitely something more social and I will say more cultural, that is need a different discussion. But for health, definitely it is important where we don't, or rather we don't think of criticizing or denying, or rather neglecting the problem when the male comes with a health issue, especially mental health. So as I just mentioned about one of the most known cricketer of the whole industry, already the hypotheses are coming, as I can see, and that is inevitable, about probably this is a background or uh, I am sorry to use the word excuse of his ill performance, which the mental health uh, concerns coming as a explanation. So this is very recent, so I can't really avoid or giving example of this. This is how classical this is. When 5 years back, or maybe even more than that, when a top actress come with her mental health concerns, that hardly was explained as a uh, down performance in her own area. But already this is less than 48 hours, probably the cricketer come with the mental health. But the majority of senses, unfortunately, even among the professionals, there is a big, I will say, doubt or question whether this is a self-explanation or the cursed word of excuse. So I don't know the reality, neither do you know, and of course we are getting all the information from media. But what I'm trying to say, the perceivedness of the society when a man says I was not well versus a woman says I was not well mentally is quite different, and that probably explains the situation, which is all interrelated.
Yes, sir. So it was a very insightful answer, and I hope people will reflect upon it. So, to end the interview on a positive note, sir, can you suggest us some ways in which men can take care of their mental health in a better way?
Yeah, that something I will say. This is the question I was thinking when I was thinking as a broad as men's health. So, as a researcher, as the policymakers, the world leaders, we have tried a lot of things. But I won't say that has not worked, but it has not worked fully also. So it's partially or less than partially successful. So we need to try, or we need to constantly try to find out the ways which will work. As of course, research and large epidemiological studies has their own advantages, but as I see with my limited experience over a decade as a psychiatrist, mental health is going to be very personalized. It's what one person needs or wants for his or her own mental health. And it is very true both for male and female. So the concept of personalized medicine or personalized psychiatry is going to be more important in the next 30 or 50 years. And it makes the things even challenging. Every person is different, every person's need and the way to tackle the problem is different, and it's never easy for a single person to manage as a professional all the problems. So this personalization, and even if we like it or we don't, that is going to be the future of the medicine. we can't generalize everybody or anybody with other. And that turns very true for men's mental health as well. Number two, the setting. This is comes as scientifically, a lot of people has tried to explain this, where and which background we are talking about the mental health. That is very important, mostly for men, definitely more than women. So everybody needs their privacy, everybody has a preferred setting, but how we are approaching for a socially till a less approachable group of people named men, that is very important for the future solutions. Third, I will say that uh, we have tried a lot of awareness. The awareness generation, it is massive. Probably it will increase more, but the outcome of the same need to be reflected, and men, how they are getting support among themselves with a good peers and a good group. So group, here also every word here is a two-edged sword. The group, a lot of people don't feel comfortable when you put in a group therapy, etc. So there comes the personalized psychiatry or personalized mental health approach. So it need to be very specific. We need to identify the need and the approach which will suit this person very specifically. So probably it is a time to reflect for us as a majority of approach has remained as a mass approach till now, which is of course quite self-explanatory, where we need to reach everybody. But without excluding that, we probably need to include the every person approach also if we want a very specific and better outcome in men's mental health.
Yes, sir. Uh, so these were a few very great ways you suggested, and it would be really good if people take these up. So, thank you so much, sir, for joining us today. And it was a very informative and
My pleasure.
insightful talk. And we hope that this will help in breaking the stigma around men's mental health, and they will be able to freely talk about their mental health concerns. Thank you.
Absolutely. Thank you. Thank you for the opportunity and the discussion forum. And don't take anybody's mental health loosely or unimportantly. That will be my take home message. And of course, men can have mental health problems too. So that single line probably explains all the discussion. Thank you.
Thank you. Bye.